just to better the outcome of treatment. But despite this, we saw a rise of 14.9% in mortalities among the people living with HIV in 2021. As for our county, by the end of 2022, we lost 261 patients, either by HIV or through HIV-related illnesses. For our facility, in quarter 4, 2023, we lost 16 patients, which is a significant number. So, as a mitigation, we decided to revise our clinical care, improve it, just to try and combat the mortalities. So we came up with this plan with an objective of reducing the number of mortalities. So what we did a line list of all the mortalities. Then we conducted mortality audits so that we came up and realized the major causes of deaths. We then conducted a series of CMEs on NCDs and opportunistic infections among the people living with HIV. We then decided to revise the patient clinic flow for the new patients. So basically, once a patient is diagnosed with HIV, everything else is forgotten, and all the efforts are geared toward HIV. So we revised the patient flow. So after identification, the patient is now seen by the clinical officer so that the patient can be assessed. We then assigned a specific lab officer. This lab officer was tasked with collecting samples, running the test, and fast tracking the results for the results. And Moranga County Referral Hospital, being a county referral hospital, we have wards, and so the CCC team came up with a duty rota for us to attend the ward rounds, because we found out that we were losing quite a number of patients in the inpatient department. As a result of that, we saw a decline in number of mortalities from 16 deaths in quarter 4 to 5 deaths in quarter 1, 2024. And these numbers are gradually decreasing. We also realized that losses through deaths were reduced. Thus we reduced attrition. There was also good treatment outcomes among the people living with HIV. And also out of the 567 patients documented to be having NCDs, 307 achieved controlled status for their NCDs, and they benefited from the multi-month dispensing. Yes. So in our conclusion, we concluded that in the era of HIV test and treat, the prevalence of NCDs is on the gradual rise. And so the quality clinical care should be therefore be optimized for early diagnosis and treatment of these NCDs and OIs, thus averting mortalities. Yes. Given that our geographical location, we are in Central Kenya. Central Kenya, we have a very high number of people with hypertension and diabetes. And again, we are seeing a rise in number of people with CKDs, chronic kidney diseases and acute kidney injuries. The higher preference of cancer is more on CS cervix, but we are currently doing the screen and test approach. We are doing the mobilization at facility level. Yes.
Hi. Sasa.
Nzuri sana. Any other question? Thank you.
Maybe to us, did you have a target that you are working to?
Of course, our aim was to prevent a death that is preventable. There are those deaths that are very preventable. For example, losing a person because of TB or cryptococcal meningitis, conditions that can be managed at facility level. So our target was to avert the deaths that were preventable. Yes. Asante.